the plan in broad brush is that everybody gets health insurance. And the way to do that is to, it's going to be phased in over 3 or 4 years. It's worth noting that the prescription drug benefit, which was a much smaller change, took over 2 years to phase in. And it will take a while to create the health exchange, the definition of the basic plan, and the like. But in that time, employers who offer their coverage will continue to offer their coverage. Individuals are expected to obtain coverage, and if they can't afford it, there are health affordability credits that will allow them to obtain coverage. For employers who wish either who decline to provide insurance or who drop it, there was an in lieu payment with exceptions for small businesses who are excused from that obligation. Really, if we don't have when I drive my car, I'm required to have insurance, and it is different, but if we're going to have this system work, we can't have spottiness. With this plan, the expectation is that 94 to 95% of everybody in the United States will have health care insurance. And if you don't have a near universal system, the costs get skewed because individuals who think they're healthy then drive up the cost and really end up freeloading on the rest of the system.
We already have that.
I'd like to read two very...
We mentioned earlier, we want you to limit your question to 30 seconds. So, we put a lot of questions.
Don't talk.
We don't want a lot of stuff read, so keep it.
Okay, I would like to read you two very short quotes and get your response to them. First one is Tom Daschle, President Obama's original pick to overhaul the healthcare system. He said earlier this year, healthcare reform will not be pain-free. Seniors should be more accepting of the conditions that come with age instead of treating them. I'd like to close on that. The second quote comes from the White House website. There is a lot of disinformation about health insurance reform out there, spanning from control of personal finances to end-of-life care. These rumors often travel just below the surface via chain emails through the casual conversation. Since we can't keep track of all of them here at the White House, we're asking for your help. If you get an email or see something on the web about health insurance reform that seems fishy, send it to flag@whitehouse.gov. What are your thoughts on this message, and what do you think his plans are for those who say something fishy?
Well, I don't know Senator Daschle that well, but I do think that Americans, we know that we need change, and yet change is uncomfortable for us. And that's the way things are. I will say that the American Association of Retired Persons has come out in big support.
They don't represent us!
This will not have an adverse impact on senior citizens. I don't know what fishy means, but I'll tell you one thing that has been discussed. And I heard my colleague, Virginia Fox, who I actually like in many respects, and we worked together on some items, but she gave a very dramatic speech saying, this measure is going to kill old people. I thought, why would Virginia say that? There is nothing in there that has even a close element to that. Now, the one thing that has been distorted is there is a provision in the bill that if a physician talks to a patient at their request about their alternatives for end-of-life care, the physician can be paid for it. That's it. That's it.
We've been warned again, if you keep this up, we're going to close the meeting. Everybody's going to have to leave.
What's wrong with this? What's wrong with people talking? It's ridiculous.
Okay, if this health plan is such a great deal, why are the President and Congress excluding themselves?
Lie.
The
Lies.
plan provides that individuals who have their current health, which I have a health plan the same as the clerks in the federal government, keep that unless it is lost, in which case they can go to the health exchange and buy private insurance. So I'm not going to be treated any different than any other employee who has an operation.
It's a lie.
The question was, how can there be talk of health care reform without talk of tort reform? And, people can differ. Torts have a very minor impact on the cost.
That's not true. It's not true.
You may not believe that, but that's what the economic analysis shows.
Doctors quit and leave states because of tort. Here we go.
Yes, sir.
Health care plan that is covering abortions, which we know that over 90% of abortions are purely elective and not medically necessary. Why is this being covered in abortion when abortion is clearly not health care?
There will be a basic benefit plan developed by a group of health professionals.
Who gets to decide?
I am sure that abortion will be covered as a benefit by one or more of the health care plans available to Americans, and I think it should be. It's consistent with the law. However, I will say this, that we have made sure that the federal contribution will not pay for that procedure. We can't pay for it.